Hi everyone. The topic for the today's presentation is insulin therapy, insulin delivering devices. I am Mrs. Sasikala, Assistant Professor, belongs to Medical and Surgical Nursing Department, going to present you regarding this topic. After this presentation, you will be able to know about relationship between carbohydrate and insulin, brief about role of insulin in glucose metabolism, and list the various insulin delivering devices. What is insulin? Insulin is a hormone produced by the pancreas to help the body use and store glucose. Glucose is a source of fuel for the body. With diabetes, the body cannot regulate the amount of glucose in the blood. That condition is called glycemia or blood sugar. Insulin therapy can help some people with diabetes maintain their blood sugar level. Next, we will see about role of insulin. The carbohydrate from the food are broken down into glucose and other sugars. Glucose is absorbed from the digestive tract into the bloodstream. Insulin lowers blood sugar by allowing it to move from the bloodstream into the muscle, fat, and other cells, where it can be stored or used as a fuel. Insulin also tells the liver how much glucose to produce when you are fasting. So people with diabetes have high blood sugar because their body does not make enough insulin or because their body does not respond to insulin properly. Because of that only people will get into diabetes mellitus. So in that we have type 1 and type 2. What is type 1? Type 1 diabetes, the pancreas produces little to no insulin. Type 2 diabetes, the fat, liver and the muscle cells do not respond correctly to insulin. This is called insulin resistance. Over time, what will happen? The pancreas stops making as much as insulin. Due to that, people will suffer from diabetes mellitus. So, for many patients, insulin will be the drug of choice for managing their blood sugar. So there are many other delivering devices are available. From this slide, let's see about what are all the various devices used to administer insulin injection. So first one is insulin syringe, external insulin pump, implantable insulin pumps, insulin pen, either disposable, reusable, insulin jet injection, insulin inhaler. We'll see detailing in the next slide onwards. First one is insulin injection, which is traditionally used so far. It gives injection, subcutaneous injection directly into the body with the help of the needle and syringes. The capacity of the syringe should be chosen depending on the dosage of the insulin. Other factors are needle gauge and needle length, both of which should be adjusted for the comfort level. Second type is external insulin pump. Although external insulin pumps remains hard to access and expensive, many people with diabetes finds them to be accurate, precise and flexible as insulin delivery system provides tight blood glucose control. Third, implantable insulin pump. Those pumps being developed are small, extremely discreet and weigh very little. This type of pump is implanted surgically and can deliver a continuous basal dose of insulin and a bolus dose when it's required. Next is about insulin pen. Insulin pens are a very useful way to transport insulin in a discreet way, allowing to administer insulin on the move. Insulin pens are either disposable, one-shot devices, or they have replaceable cartridge of insulin. The tip of insulin pens include a fine, short needle, and diabetic patients can turn a dial to select the correct dosage. The next type is insulin jet injection. This type of device sends a fine spray of insulin through the skin using a high pressure air current as opposite to a needle. Insulin jet injectors are an amazing alternative for those people with diabetes who have needle phobia. So dear viewers, so far we have seen about various type of insulin delivering devices. Hope you are clear about this. This is the book and the internet references I have referred. Thank you for watching. Thank you once again.